A large turnout of Karamajiji community residents for a free medical outreach has underscored the need for improvement in primary healthcare service delivery in rural communities. The outreach, organized by the West African College of Physicians Nigeria chapter, is part of the Society's corporate social responsibility and activities to mark the 45th Annual General and Scientific Meeting. National Chairman of the College speaks on the outreach.
What we have seen here is a well-organized, systematic, structured outreach where you could see the population in need of service, the men, the women, and the children, and they will also have the security with us. We have the leadership of the community, as you have just seen, His Royal Highness, the village head, Malan Dauda, who has come to visit us here. And we have actually set out the whole system to provide services to address health needs of the people with respect to common problems, which could also be or likely going to be both infectious and non-infectious diseases.
Mr. ABUBAKAR MUSTAPHA, an internally displaced person from Maiduguri and a beneficiary, tells us more.
It's not only me that benefited this exercise. Many of my people, I see over 200 of my people are here, and I know they all benefited, and they are still coming in to get their medicine. Like this, my daughter, last night she didn't sleep throughout last night because of the environment. We are sleeping. See my daughter medication, see mine. So I'm very, very grateful to get this, because this morning I'm on my way to primary health care to at least get medicine. Not for me, it's just for my daughter. I know my own, I can take maybe something that make me relief to get better. But now my daughter gets her own, and I also got my own medication. So I'm saying thank you for this NGO, and this is a very wonderful support.
Another beneficiary, Mrs. AISHA ZAKARI, had this to say.
I am happy with this development because most times we do not have the resources to afford the medicines given to us by the health center. Sometimes when we have money and we go to the healthcare center, the money can only buy some of the medicines prescribed, and so we are only given the medicines we can afford. I also have 2 children who have not been feeling well. When I heard that a free medical outreach will be carried out here and medicines will be given as well, I decided to bring my children and myself.
His Royal Highness Dogo called for improved healthcare delivery in the community.
Wow, it's really exciting. I don't even know what to say and where to start because it's amazing. You can see the members of the community jubilating today because of the outreach you just came to render in our community. Because as you can see, the community, not every community member can even afford to take 3 square meals a day, not to talk of going to hospital and afford drugs.